ways to be planned. Today I'm going to perform a dwelling application. So first I'm going to review the doctor's order. Doctor's order, insert and dwelling fully classified. Afterwards, I'm going to identify the patient. The patient's name is James. Then after, I am going to assess for allergies. Afterwards, I'm going to explain the procedure.
Explain the procedure, you will.
And then after we are going to hand wash and prepare the urine for the
Since you already prepared all the equipment,
and
you
then
will.
after we're going to provide guidance for the patient.
And then you will.
Then we're going to position the patient.
So you already what?
Then after we are going to assume that the patient is already covered with the blanket.
Okay, covered with blanket and
the waterproof pad is already under the blanket.
now what will you do?
And then we are going to check for the water temperature.
Check for the water temperature.
And then we are going to wear gloves.
Okay,
And
assuming you already wear the gloves, what's the purpose of wearing the gloves? You will.
we are going to perform corneal washing.
If assuming you're done with cleaning the perineal area, what will you do with your gloves?
After we are going to remove our
And
gloves.
then
And then we are going to open. We're going to open the image package.
and then once you open, you already put your sterile dressing, that white one. And then after,
We're going to put the grape.
okay, great. So once you're done with the drape, before you will do the gloving,
We
you
are
will.
going to ensure that the image pad is connected to the catheter.
Okay, connect. Then
We're going to wear sterile gloves.
uh,
And then after we're going to test for the
you will place the what is it? Then test the balloon. How are you going to test the balloon?
started by version.
Okay. Insert with the center, so you will not be tight. There's a center there, in the middle of the circle. So do not force, because meaning you are in the wrong area. Okay. Okay. Stop. Pause. So successfully, you will withdraw
We're
the.
going to withdraw.
This is successfully completed. Now you will withdraw. And then leave it.
And
Leave it there. Okay. Now what will you do?
then after we are going to retract the female's labia to clean the meatus.
Retract. And then clean with iodines, forbidden iodine times. Okay. And then for the male.
Male, we are going to grasp the penis.
Okay, grasp. And
We're
then
going to clean from inner to outer.
okay, inner to outer. And what will you do after? You will inject
We're
the.
going to inject the lubricant,
Okay, what do you call that lubricant in that syringe?
the
Lube syringe. Okay, inject the lube syringe. And after that,
we are going to proceed
okay,
in the
insert.
insertion.
Okay. Okay, you observe that there is backflow of urine, and now you will continue to insert up to where?
Until the bifurcation.
Up to the bifurcation. Okay, insert up to the bifurcation. Okay, insert. Okay, once you reach the bifurcation,
We're
What will you
going
do?
to inflate the
Inflate the balloon. Okay, inflate the balloon. Okay, assuming already inflate the balloon,
And
what
then
will
we're
you do with
going
your
to remove
syringe?
the syringe
Remove the syringe. Okay,
using the
remove.
tissue.
Okay, remove. Okay, and then
And then after we are going to tug until the resistance
until
is
tag. So, tag slowly. And then when you meet the resistance, what will you do?
we are going to secure the
Okay, secure
catheter.
it with the tape. Okay, now secure. Once you're done tagging, secure with the tape. Okay, once you're done with securing with the tape,
After
what
we are
will you
going
do?
to place the drainage bag
Okay,
below
put the
the
drainage
catheter.
back, the urine bag. So, assuming that you're done with attaching that the urine bag, what will you do with your materials?
So after we are going to dispose all the materials that we have properly
Okay, remove the gloves and then
we're going
okay,
to
perform hand
position
washing. And then what will you do with the patient?
and we're going to reposition our patient.
And then finally,
Then finally we're going to document the procedure and the assessment.